And we're live.
All right. Happy Friday afternoon and welcome to our Safe, Strong, Ready Facebook Live series. My name is Andy Forlis and I am the very proud superintendent of Mesa Public Schools. We have an amazing school district that is doing everything that we can to keep our staff and our students safe during this global pandemic. And that's the topic of this Facebook Live session today. And I am so fortunate that our associate superintendent, Mrs. Holly Williams, is here with us today. Holly has become our expert in the field of COVID 19. Um, she has been working on not only school closure, but then also leading the task force to open up our schools. And so that means that she has been our guide around really paying attention to all of the newest and most updated information. So before we start jumping into questions, like you I would like to give some information around what we know about student and staff safety during COVID 19. As we have designed our safe, strong, ready plan to open up our schools, we have had two guiding commitments that have been incredibly important to us. And that is that we are opening every decision we make is with keeping the safety of our students and our staff in mind. So much of what you are going to hear today is our commitment to learning about what that looks like as this pandemic continues to change. So, some of the things that you might hear about are mitigation strategies. The Department of Education is requiring us to post our mitigation strategies on our website. And so that is the strategies that we are using to mitigate or to tame the community spread of COVID 19. And so you will see that information on our reopen page. We also are spending a lot of time thinking about cleaning protocols, and I know you're going to have questions about that, air filtration, as well as what are we going to do with personal protection equipment. So we are prepared to answer all of those questions this afternoon. So we're going to get started. The first question that is coming in, we've got about 30 minutes, so we will be answering questions till about 4:30. So keep those coming in, and we will respond to them as quickly as we possibly can. So, the big question that families and staff and our community members have is how will we know when it is safe to open up our schools to transition from remote learning that we're currently in into that modified in person? So, Mrs. Williams, can you walk us through that?
Absolutely. Thank you, Dr. Forlis. So, good afternoon, everybody. I'm so thankful that you're here. Like minds around when it is safe to reopen is an important thing, and the collaboration that we do in this and the conversations that we have are crucial. So, as we've said since the beginning with our Safe, Strong, Ready plan, we wanted to base our reopen phasing opportunities based on data, not a date. And so we have been waiting for guidance from our State Department of Health and Maricopa County Department of Health to give us some benchmarks or some metrics to use for those reopening plans. Those were released yesterday from the state, and we are expecting, and on Wednesday from, excuse me, the county, dashboards to follow from both so that we can drill down to the Mesa data, because currently the farthest that we can drill down is Maricopa County. But I'd like to share with you a little bit about what those metrics are. Those metrics include the number of cases per 100,000, the percent positivity, and the COVID-like illnesses. And those would be paying attention to how burdened our healthcare system is. So in a case of I want to go back. What's beautiful about the metrics that were released by the state is that they align with the phasing that we have designed. So there is a category for remote learning that we should stay in remote learning if the benchmarks of the metrics are here. There's a place for us to go into hybrid, which is the modified in-person that we have planned for, which is an every other day type of situation. And then there is the fully in-person or the minimal spread. And so they've given us the metrics that we can use to measure ourselves to say when that can happen. So currently, you have to have 3 green check marks in order to be able to move into the next set of phases. And we currently in Maricopa County have 1 green check mark. We are looking to get to 3 so that we can begin our planning. When community spread is at 7%, is when they recommend that we are able to move into the remote learning. along with, I'm using my cheat sheet here, 5 out of 10, so excuse me, 5 to 10% for the COVID-like illnesses, and 10 to 100 cases per 100,000. That would allow us to move to the modified in-person learning. So we are watching this data carefully, watching it daily as the more metrics are available to us. We have been promised a dashboard that will drill down to zip codes next week from Maricopa County, so that we can use that information to make decisions specific to Mesa and not make our decisions based on what's going on across the county.
Thank you so much. And, I think that what's really important, as Mrs. said, is our commitment that we are going to use data, not a date, to open up our schools because we believe that's safest. And one of the things that we also know is that we need to increase the ability of access to testing. So I want to let you know that this is hot off the presses. We have not formally communicated this to our community. So this is first on Facebook Live, that there is free COVID-19 testing at Mesa Community College. It's open right now. It is free, regardless of insurance. It is open 24 hours a day, 7 days a week. So if you have interest in getting tested, the more that we find out that we can pay attention to testing, pay attention to those positivity rates, and get our community spread down, the better we'll be to open our schools in the safest way possible. So again, Mesa Community College, free COVID-19 testing, 24 hours, 7 days a week, open now. And we will get that formally communicated out to all of our stakeholder groups. So,
Dr. Froelich, I'd like to add that is by appointment. So I encourage all of you to go to the MCC website and click on their link to set your appointment time. That'll cut down on the wait time too. So it's a very handy feature to be able to make an appointment for that testing.
Excellent detail. Yes, that you would have been really upset with me if you drove down there and you didn't have your appointment. So, an appointment. Thank you. Thank you. So what could we expect? We are talking about school being open. Mrs. Williams, what could we expect the safety protocols at a school to look like when we return?
Yes, we have laid that out in our safety protocols that we shared on our Safe, Strong, Ready website, mpsaz.org/reopen. And in those safety protocols, it includes things like we expect all students to wear masks, as outlined by executive order and the guidance from Maricopa County. So if your student is 5 or older, they are expected to wear a mask. 6 or older, 5 and under do not have to wear one. We will have physical distancing in the classroom. So because we're going to return into a modified in-person, the students will rotate and half the class will be there on any given day, which allows us to space the chairs apart, and maintaining a 6-foot physical distance with the rows facing forward. And keeping a cohort of students together to the greatest extent possible, so that we don't have switching for reading groups at the elementary or math groups. They will stay with their homeroom teacher for the entire day. At the high school, that's a little bit different, but we will maintain their subject area groups and not have them transferring between classes as often as possible, and perhaps adding additional lunch hours to stretch the day a little bit and cut down on those large crowds at the high schools and the junior highs. Additionally, all of our staff will be provided with 2 cloth face coverings and 1 face shield. We have purchased 2 different kinds of face shields, and they are on their way as we speak, so that we are prepared for when we are able to do the modified in-person. We will have one that comes down from the forehead and another that comes up from the neck, knowing that the different kinds of teaching styles will necessitate different kinds of masks depending on the subject area and the age of the student that you serve. In addition, we have hand sanitizer in every classroom. We have spray cleaner and paper towels also in every classroom, and all of those are refillable. So it won't be that when that bottle ends, you throw it away and get a new bottle. We have big jugs in our schools so that the custodian and the facility assistants can refill those as often as necessary. We are providing all of that. We are making plans for how do we make sure that materials aren't shared as often as possible. Teachers are planning for that, and our leadership is planning for that. How do we make sure that they stay in that physical safety? Lunches will be eaten in the classroom as often as possible, and when not, significant physical spacing will be allowed. At the elementary school, we will allow recess so that we know that kids need to exercise and run and play, and that'll be an important component. And we'll try to maintain smaller groups out on the playground as we can. I think those are most of the things that we have in our mitigation plan. We also, of course, have reporting protocols for symptoms and things like that. We're asking our parents to cooperate with us and do a health assessment before they send their students to school, so that we don't bring the infection in if anybody's experiencing symptoms. And so we have protocols for that, that when we begin the operation of coming back in person, families will have a checklist to check their students daily and an attestation that says that they agree to do that.
Thank you. That's a lot of information, and there's been a lot of work that's been done by our operations department, our purchasing department, to make sure that we are very ready with the equipment that we. Another thing to be thinking about is when you walk into the front offices, it's going to look a little different. We are installing plexiglass to keep some physical distance in those smaller spaces, and that we will have plexiglass dividers that, should a teacher believe that they need one in a classroom, they will be available for order as well. Also wanted to mention that our drinking fountains, they will be used to fill a water bottle only. So we're really thinking about a lot of the details walking through the typical day of a student. You'll see directional arrows within our schools, reminders of what a 6-foot distance looks like. So lots and lots and lots of planning has been happening. Also would like to share that we have had constant checking of our filtration system through our air conditioning, our HVAC, to make sure that our filters are properly changed and there's the proper airflow through our classroom. So I know that that's been a big conversation as well. So much information. We've got lots of people working on this, and we just keep getting better with it every single day. So I've got a clarifying question here about that MCC campus. Mrs. Williams, is that MCC Dobson?
Yes, thank you. Yes, that's the main
Thank you.
campus.
Yeah. Just said it out loud. All right. So here we go. Here's a question. Why are you requiring masks if they will also be distancing?
The executive order specifically speaks.
Did I lose you?
Yep, you were.
I think I might have lost you.
I'm here, Dr. Forlis. Ina, can you
keep going?
Okay, I'm going to go.
Okay.
So masks are required under the executive order and by Maricopa County. So that's why we're requiring masks. It's not an optional to do it if you can physically distance. It's included in the order that all students and adults in the buildings will wear masks.
Yes, thank you very much. That is statewide. So that is a statewide requirement. So thank you for clarifying that question. Also, can you give us some information? Here's a question. When will the information on free on-site student support centers be available to our families?
Thank you. That's a really good question. We are working on that feverishly as we speak. We are selecting the sites and making sure that we have all the safety protocols and the registration information in place. We will be sharing that with our community next week, as we promised in our last communication with families. So you can expect to see something Wednesday.
Thank you so much. I know that that's a big undertaking. And again, safety will be the primary driver on the design and the enrollment in those programs. I think I could take this one. This question is, will the Explore Enrichment Centers extend after the 14th? And it is my understanding that they will extend at specific sites for before school and after school care.
That's right.
All right, let's see. We've got another question that is coming in. So what can you walk us through, Mrs. Williams? What happens if a staff member or a student tests positive for COVID-19? What would happen?
If a staff member or a student tests positive for COVID-19, we have a reporting form that we are tracking those cases. We intend to track those cases on. And we give them the Maricopa County guidance. So if a student or a staff member contacts COVID-19, they're expected to remain home for 10 days after the positive test and to be fever-free and symptoms reduced for 24 hours before they come back. And that's without medicine. So say, for instance, you get a positive test on a Tuesday, 10 days from that date, you're still experiencing symptoms and still have a fever and have to take Tylenol or something else to reduce that fever. Then at the end of that 10 days, until you've gone 24 hours without needing medicine to make that fever go away, you cannot return. So we would ask that of everybody, and we have very specific guidance shared by the county to help folks know what their parameters are. Healthcare professionals also provide that to staff and students or anybody who tests positive. So if you receive a positive test, you get a packet of information that shares with you what your quarantine status would be.
Thank you. And a question is coming up around what can I, as a parent, what can I do to help my student be safe when they're at school? And one of the things that we have done is on our website, we've added some age appropriate videos. So there's some videos to be able to share with students. And I think that what's really important is helping them to understand the why. Why are we asking for face coverings? Why would the governor of the state of Arizona ask us to, all of us, to be wearing face coverings? And that's a great conversation to have with students in preparation. Also, I think it's important for them to understand about physical distancing and why it's important to kind of to keep their space, or as some will call that, their safety bubble. We know that as adults, sometimes we walk out the door, we forget our masks. So we're going to have reminders to one another to say, oh, remember, you got to wear your face covering, got to remember to keep our 6-foot distance. So I think it's going to be just new norms in classrooms, and our teachers are amazing at being able to teach those in age appropriate and very friendly ways that make sense when we have the ability to come back in person. Also want to mention, Mrs. Williams talked about the student attestation, that we're asking our families to do that self-assessment before kids come to school. That same thing is going to happen for our staff. So staff, before they come into the building, they will do a health assessment, and they are going to submit it electronically, telling us that they feel that they're safe enough, that they're healthy enough to come to work. That's very helpful information so that we can properly plan so that our children are safe, because our children are safest when they have healthy teachers in front of them. So it's important that we continue to remember that. So here's a question. If a student unenrolled during remote learning, can they re-enroll when you go to in-person?
Absolutely.
Yes, please.
Yes.
Come back in. Yes.
Yes, I don't have any better words than that. Absolutely, we welcome you back with open arms. We're happy to have you as part of the Mesa Public Schools family. We would want you to be here. Absolutely.
Yes, and just another opportunity to remind families that we are in a remote environment now. And as Mrs. Williams said, our next phase is to go to modified in-person. But a family might make the choice that remote learning is the best option for their family, and a child can choose to remain in remote learning throughout the year. So that will always be an option for them. Okay. Mrs. Williams, here's another question. How is Mesa Public Schools helping families who are struggling with remote learning?
So we have what we call our family support networks and a help button on each website, including the Mesa Public Schools homepage, that it says, I need help or help. And if you click that and say, and tell us what your needs are, we are helping you. So if your technology needs are, I have a device and it's not working, there is a hotline that you can call that is staffed extended hours during the day to answer your calls. I will tell you, this first week, it's been quite the busy week. So there might be some backup, might be some delay, but they will call you back. So if you leave a message with your information and your number, they will call you back. The other piece is, if you don't have technology yet, reach out on that help button and say, I don't have technology. The internet is not accessible in my home. I need some help. We have a team of people surrounding to try to work with Cox to Connect and other local low-cost opportunities for internet. And they will work through every option with you until they get your students connected. So be patient with us, because the helpline is backed up this week, but not so that they won't get to you. So leave a message with your information and they will call you back to help come to a solution to your challenge.
Thank you. And so I know that you've done a lot of work on studying these metrics and the impacts of COVID-19. How will contract tracing work if a student or a staff gets sick?
So contact tracing, obviously, we're not going to be as sophisticated as the county. We're going to be a very low tech thing here, but we are aware of the cases that happen at each school. We have a form and a database that we have started to be prepared to collect that information. We have asked for our administrators and our district leaders to help us to collect that information, and it will be sorted daily. We do have a COVID-19 tracking team that works together, members from the risk benefit department, my office, and human resources working together to make sure that as we notice these cases that, I'm sorry, I forgot the most important part. Our health department, Nadine Miller, Director of Health Services, is also on that team, because my next phrase is we have to work in conjunction with Maricopa County Health, who we have always worked with on health-related issues, and Nadine has a close relationship with them. So for years and years, we've tracked other things like whooping cough and chickenpox back in the day. And so this is a familiar but bigger kind of tracking that we're doing. And so we have created this database and this team of people to make sure that we are staying on top of where we're seeing cases occur and making sure that we're doing the appropriate communication to our county partners.
And as we think about instruction and we think about as children begin to come back into our schools when it is safe to do so, we've talked about keeping our kids in what we call cohort groups of 10 to help with that, so that if they stay within that same group, it's easier to be able to trace back where that might have come from and to more quickly respond. So when you hear that kids are in groups of 10, we are hoping to keep those same groups of 10 together so that we mitigate that changing, as Mrs. Williams had talked about earlier. I'll take this question. Does the helpline, that big red help button, does that include mental health? And the answer is yes. And this also goes with another question that says, oh my gosh, our children are so unhappy and remote. Help, help, help. That is worthy of the help button. Help, hit the help button and say, we need some help here. Please also reach out to your teacher, reach out to your counselors or social worker at your school. Oftentimes the first couple of weeks of school, there is a transition that happens in person as well as in remote learning. And so if kids are not transitioning well, and if remote learning is just really making them sad, please reach out to your teacher as well as that help button. Again, we know that students learn best with their teachers in an in-person environment, and we have every intent of getting to that in-person learning as soon as we have healthy, safe teachers that can be teaching safe kids. Got to get this under control. I think another thing that we can do as a community, now that we have these metrics, we really need to think about our own behaviors and say, how can we behave in such a safe way moving forward so we can get these numbers down so we can get kids back in school. Another question is coming in. Where can we get technology help for our Spanish-speaking families?
So currently, there are resources available through our help desk that connects us also through our language line that we are using to help us with the volume that we have for our Spanish-speaking families. It's not flawless like anything right now. It's not the perfect system, but it is what we're working on. We are also utilizing staff at the schools to help us in the translation services to help with those conversations. The families who have language challenges often interact with folks on their home campuses, so we're utilizing that familiar face, familiar voice to help us translate in the technology challenges also.
That on our website, there's a button to click to translate information on our website to Spanish. That is another helpful step. We know that this is something that is a huge barrier, and those family support teams as well can help to identify what, not just Spanish language, but we also know that we have other languages that are spoken in our community so that we can get adequate and timely and relevant information to them. So the question, here we go, back to those benchmarks. Will Mesa Public Schools align with the state benchmarks?
It is our intention to align with the state benchmarks. We'd like to compare them with the county benchmarks and make sure that they are in alignment. But our goal would be to create something that we can take to the governing board and say, this is what we feel most comfortable with based on the guidance from the state and the county. So, and they are very close to perfect alignment. So we will use both to craft our plan.
And I think what's an important detail about that is the state of Arizona came out with benchmarks that would make sense across the state. And so we have that ability, as Mrs. Williams said, is to take a look at what is happening in our community, in our very large school district of Mesa Public Schools. So we'll be making decisions locally that are in alignment with those state numbers. There's another one that says, will you close if the data gets worse? So what we need, so the data is currently, if you are at 10% positivity rate in your community, you have to be in remote learning. So let's just say that we go to modified in person when we get down to about a 7% rate, and then all of a sudden that starts to creep back up to 10. Well, when that creeps back up to 10, school again. So that will be monitored by the county health department. And that's why it is what we call intermittent or rolling closures. So it has been important for us to start this remote learning so that we can get a handle on this. So when we can come back to that in-person learning, should we have to close again, we have a system and a structure for our kids to honor that continuity of learning for them. So yes, we would have to close. Please. Oh, okay. Special education. There was a question up here that I'm still going. Special education. Is it possible for special education students to return on August 17th?
We are working on a plan to return when it's safe for our special education students to return, knowing that many of them struggle with remote learning. So stay tuned. We should have some more information for you next week about our plan to return in a safe manner, how we could do small populations where we could control the size of the group and do it in a safe manner. But I don't have a date for you yet because, again, we're basing our things on safety.
Here's another one for you, Mrs. Williams. Can marching band get started?
I have been speaking with Mr. Bergener about marching band season, and because the football season has been pushed back and the marching band competition season has been canceled for the fall, we are working on a plan to return marching band. Again, we have to consider how we would do it with small groups and how we would do it safely. So we are working towards that. I know Mr. Bergener reached out yesterday to have some more conversation about that. So the answer is I hope so. I am a big marching band fan, one that believes that it adds this tremendous value to our community and to our school culture. And I would like to see that get going. So coming up with a safe plan to do that with our directors is an important step for us. So we will be talking about that more in the coming days.
And I'm watching our time. We've got 2 minutes left, and we've got about 3 questions related to free on-site centers. So maybe the two of us can work on this.
Okay.
So the questions is, one of them is, who is teaching at the free on-site center? And I think that's really important to clarify. These free on-site support centers are to help those who are very much struggling with remote learning, and that for a variety of reasons. They are not staffed by teachers. Our teachers are teaching in a remote environment, so there will be no teachers in these support centers because their number one job is to teach their children, and they're doing that in a remote setting. So it is not teachers. It would be support staff that would do everything that they can to support students, getting them logged onto computers. The executive order states that we have to have these support centers open during the school hours. So that is the time frame that they would be open. There's another question that says, will they be? Yes, they will be free. They have to be free. And then the next one is something that we're really struggling with. And the question is everybody eligible for the free centers? The executive order and guidance that we are receiving from the Arizona Department of Education, the Maricopa County Health Department, and so on, are putting together some additional information about these free on-site support centers, because if they're free and eligible to everybody, we are not able to physically distance properly. We cannot follow safety protocols, and safety has been a primary decision maker for us in Mesa Public Schools. So we are as Mrs. Williams said, we will be communicating. We will identify sites that will have these family support or these student support centers, and we will have a registration process. And the registration will be dictated by what can we safely provide. So I wish I could give you a lot more details about that. We're getting additional guidance coming our way next week, and we will continue to follow that. But right now, stay tuned for more information. And we do know that certain populations of children have a much more difficult time accessing remote learning, and that would be Mesa Public Schools' priority. Okay. Two sets of notes. I think we've got all of those. I want to say thank you very much. Your questions are very, they're important to us. We are being as honest as we can, giving every ounce of information that we have at this time. And we look forward to staying in touch with you. This is our last in a 2-week series of Facebook Live. We wanted to get through the first week of school, and then last week was the preparation of school. Every Wednesday at 4 o'clock, we will continue. So we will be here to answer questions. And I really thank you for joining us. And if you're interested in any of our other Facebook Live sessions that we have done, whether you wanted to know specifically about special education, if you want to know elementary, preschool, secondary, if you just had general questions, we have recorded all of these and they are posted on our website under our Safe, Strong, Ready, Reopen plan. So it is there for you to go back and take a look. And Ina, we're going to close out. If you'd like to put in our closing slide, that takes us to our very informative website. Bring that to you. Thank you so much. Thank you, all of you parents. Thank you for all of you have done to support remote learning. Employees, thank you, students, for remote learning. Have a wonderful, wonderful weekend. Thank you.